Dr. Sandra Lee's rise into a global medical personality was never sudden in her own mind. It was built slowly, session by session, patient by patient, inside a dermatology clinic in Southern California. What began as a traditional medical practice eventually transformed into a media phenomenon that reached millions across the world. Patients came not only for treatment, but for the reassurance that their most personal skin concerns would be handled with precision and care. Over time, cameras became part of the environment, and her work expanded into something far larger than a clinic. Yet beneath the viral fame and growing brand, she remained, at her core, a practicing physician. On most days she appeared composed, methodical, and entirely in control. No one watching her work would have guessed that her life was about to be interrupted in a way that would challenge everything she had built, both professionally and physically. The subtle beginning of something serious. It started on what should have been a routine filming day at her Upland clinic. The environment was familiar: bright lights, patients waiting, cameras capturing procedures that millions of viewers had come to expect online. Dr. Lee moved through her schedule with the same efficiency she always did, transitioning from one case to another without hesitation. But somewhere in the middle of that rhythm, something shifted internally. A sudden wave of heat washed over her, followed by a strange sense that her body was not responding in its usual coordinated way. It was subtle enough to dismiss at first, the kind of discomfort many people might attribute to fatigue or stress. She paused briefly but continued working, convincing herself it was temporary. The demands of the day made it easy to ignore what might otherwise have been alarming signals. In hindsight, these early moments were the quiet beginning of something far more serious unfolding beneath the surface. Warning signs that could not be ignored. By the evening, the initial discomfort had not faded. Instead, it followed her beyond the clinic and into the quieter setting of her parents' home nearby. The change in environment did little to settle her body. Instead, a growing unease settled in. Her leg began to send intermittent sharp pains, the kind that disrupted focus and made simple movement feel uncertain. She attempted to rest, hoping sleep might reset whatever imbalance she was experiencing. But the symptoms did not behave like ordinary exhaustion. When she moved, her coordination felt slightly off, as if her body and intention were no longer perfectly aligned. These sensations were easy to rationalize individually, but together they formed a pattern that was difficult to ignore. Still, like many professionals accustomed to pushing through physical strain, she tried to minimize the significance of what she was feeling, unaware that her condition was progressing in a far more dangerous direction. The morning everything became clearer. The following morning brought a shift that could no longer be dismissed as fatigue or stress. As she tried to go about her routine, her body responded unpredictably. Walking felt unstable, as though her balance system had been subtly disrupted overnight. Then came a moment that created immediate concern. Her left hand no longer obeyed her intent in the same way. It weakened unexpectedly, collapsing without warning. This was followed by difficulty forming clear speech, where words emerged in a slurred and disjointed manner. The combination of motor and speech impairment triggered an immediate internal alarm. As a physician, she recognized the possibility that many people miss or delay acknowledging. The thought of a stroke surfaced quickly, not as speculation but as a serious clinical concern. Even with that awareness, there was hesitation. Medical knowledge does not always translate into immediate action when symptoms are personal, especially when denial competes with fear. Knowledge versus denial in a critical moment. What made the situation even more complex was her awareness of exactly what the symptoms suggested. She knew the clinical warning signs: facial changes, weakness, speech disturbance, and loss of coordination. Yet even with that knowledge, her mind attempted to rationalize the experience. This conflict between professional understanding and personal denial is more common than it appears. Many individuals, even in medical fields, hesitate when symptoms affect them directly. The human instinct to minimize fear can override trained judgment in moments of vulnerability. For Dr. Lee, this meant briefly questioning whether the symptoms might resolve on their own or be related to something less severe. However, the persistence and combination of neurological signs made it increasingly difficult to dismiss the possibility of a serious vascular event. What complicated matters further was the subtlety with which strokes can present in real time, especially when symptoms begin gradually rather than dramatically. The moment intervention changed everything. The turning point came when her father observed her condition directly. As a physician himself, he immediately recognized that the symptoms were not something to monitor casually or delay. Without hesitation, he urged her to seek emergency medical care. This external confirmation helped override the internal hesitation she had been struggling with. In situations like this, timing becomes critical, and the decision to act quickly can significantly alter outcomes. The urgency of his response reflected not only medical understanding but also the emotional clarity that sometimes escapes the person experiencing the symptoms. With his insistence, she was taken to the hospital for immediate evaluation. What followed was a rapid series of diagnostic tests designed to identify whether a vascular blockage was affecting her brain. In such cases, every minute matters, as untreated interruption of blood flow can lead to irreversible neurological damage. The transition from uncertainty to emergency response happened quickly but decisively. Diagnosis and the reality of brain injury. At the hospital, imaging confirmed what had been feared: an ischemic stroke caused by a blood clot restricting blood flow to part of the brain. The diagnosis carried immediate implications. Unlike temporary conditions, a stroke involves actual injury to brain tissue due to oxygen deprivation. Once cells are lost, they cannot regenerate, which makes early intervention crucial for minimizing long-term effects. Hearing the diagnosis created a new emotional reality. It was no longer about uncertainty, but about damage already done. The phrase she later used, describing that part of her brain had effectively reflected the severity of what had occurred. For someone whose profession depends on fine motor skills, precision, and communication, the implications were profound. The medical explanation was clear, but the personal weight of that clarity was far more difficult to process. It marked a shift from being a caregiver to becoming a patient confronting neurological vulnerability firsthand, identity disruption, and professional risk. The consequences of the stroke extended beyond immediate health concerns. Her career had been built on steady hands, clear communication, and precise surgical technique. These were not abstract qualities but essential tools of her profession. The possibility that any of them could be compromised introduced a deeper fear than the medical diagnosis itself. A physician who built a public identity around skill and control suddenly faced uncertainty about whether those abilities would fully return. Even routine tasks became a source of anxiety during recovery. The emotional impact was compounded by the visibility of her career, where millions had come to associate her with confidence and consistency. Now, that identity was placed under threat. The experience forced a confrontation with the fragility of physical capability, especially in professions where fine motor control is not optional but fundamental to daily function, a foundation built before fame. To understand the weight of what she nearly lost, it helps to return to her origins. Her path into dermatology was influenced heavily by her father, who practiced medicine in challenging conditions in Malaysia before continuing his career in the United States. His early experiences, including limited resources and reliance on basic reference material, shaped a deep commitment to learning and problem-solving. This environment influenced her upbringing and interest in medicine. However, her journey was not without setbacks. At one point, she was not initially matched into dermatology, the field she had long envisioned. That rejection forced her to reconsider her trajectory and re-establish her path through persistence and additional training. Eventually, she returned to the specialty that aligned with both her passion and family legacy, later taking over her father's practice and continuing the work he had begun, the unexpected rise of a digital phenomenon. Her transformation from local dermatologist to global media figure began almost unintentionally. In 2010, she started sharing educational content online. Early videos were modest in reach and professional in tone, reflecting clinical procedures without expectation of widespread attention. However, one particular video featuring a blackhead extraction unexpectedly captured global interest. The reaction was immediate and overwhelming. Viewers found the content strangely compelling, and the simplicity of the procedure made it widely shareable. Over time, her online presence expanded rapidly, eventually earning her the nickname that became a brand in itself. What started as medical documentation evolved into a global digital phenomenon, blending education with entertainment. Millions of viewers followed her work, and her influence extended beyond clinical practice into television, skincare products, and public recognition, creating a unique intersection between medicine and media visibility. Pressure, growth, and the cost of constant output. With increasing fame came increasing demands. More filming, more patients, more public appearances, and expanding business ventures gradually filled every part of her schedule. While the growth was professionally rewarding, it also introduced a sustained level of pressure. The pace rarely slowed, and over time, the accumulation of responsibility created physical and mental strain. Subtle warning signs, such as elevated stress levels and underlying health risks like blood pressure concerns, were present but not fully prioritized amid ongoing commitments. This environment created conditions where rest became secondary to productivity. In retrospect, the stroke did not appear as an isolated event, but as the result of multiple compounding factors over time. Yet during the height of her career activity, these risks were easy to overlook. The momentum of success often creates its own sense of invulnerability, even when the body is signaling otherwise. Recovery, return, and a changed perspective. Recovery after the stroke was neither immediate nor predictable. For weeks, she stepped away from operating and filming, focusing instead on restoring basic functions such as coordination, balance, and speech clarity. Simple actions required conscious effort, and the uncertainty of full recovery remained present throughout the process. When she eventually returned to work, the environment felt familiar yet altered, as though layered with memory of what had occurred. Rather than hiding the experience permanently, she later chose to speak openly about it. This decision was not driven by attention but by awareness that many people ignore early warning signs of stroke. By sharing her experience, she aimed to encourage earlier recognition and response in others. Today, she continues working, though with a different perspective shaped by vulnerability and resilience. The experience did not erase her career, but it reshaped how she understands health, control, and the limits of endurance in ways that remain with her.